Listen, we are advocating for the death penalty for the corporate medical gatekeepers and the intelligence agents and officers that help them. Not just a fine, not just jail time. Do not let them enjoy their ill-gotten gains because they decided to step down. If you let them live, they'll do it all over again. We are talking about asthma, the theoretical cure today. Breathe in, breathe out. A relief. Okay? I know y'all about tired of that inhaler. Let's get rid of it. Hey, I just had to throw a little discouragement out there for the next knuckleheads who want to try this same idea. Just selling the treatment for profit. Those days are gone. This medical industry is a crying shame. It is pathetic. And I'm not talking about the doctors and the nurses. Asthma patients, y'all ready? There is a cure. Let's get to it. All right, so asthma, it can be a little complex because it's multiple sources to where asthma can stem from. What I mean by that, I like to go after the source. I'm not patching up any symptoms. We go after the source. That's how you cure it. Well, one person can have a source from asthma, and another person who also has the asthma diagnosis may have their source from another way, another situation in their body. So I know about 5 ways that you can have asthma, 5 sources that we can get to and get rid of. Now, if I figure out more, I'll be sure to update. But right now, I'm going to go with these 5. And I know this is going to cure most of you. I'm certain of it. So the objective here is to see which one you got. What's your source? My advice is every step that I list, I would check them all off. When you with your doctor, go through all 5 steps. Now, we just hope and pray you don't have more than one of these, but if you do, you should be able to take care of it anyway. All right, so we can get you to living and breathing good, because this is a hindrance that doesn't have to happen. There's a lot of lies around it. Okay, number 1, and maybe most of you have this one. A lot of you have a tumor in your stomach. This tumor produces stomach acid, an abundance of it. And that's what causes a lot of the problems like abdominal pain, diarrhea. That's a lot of acid, so it's going all up your esophagus. It's creating ulcers. It's of course it's making it hard for you to breathe. All of that. There's an acid producing tumor in the stomach. It's almost like a form of gastric cancer. Gastric is stomach cancer. So what you want to do is simply remove the tumor. Now, this is, in my opinion, a misdiagnosis. There's an illness called Zollinger-Ellison syndrome. ZES acronym, Zollinger-Ellison syndrome. All right, it's a stomach acid producing tumor, and it's going buck wild in your abdomen. We gotta get rid of that. So there's gonna take surgery to get that tumor out so it can stop wreaking havoc in your body. All right. Now, from my research, from my decoding, Zollinger-Ellison syndrome stems from alcoholism, alcohol abuse. That can lead to asthma. especially the ZES, Zollinger-Ellison syndrome source. So if you abuse alcohol, it can give you stomach tumors. Now, when I was researching ZES, they're going to say, oh, it's alcohol is not linked to it. But if you research alcohol, it is a carcinogen, which means it is cancerous, and it can create tumors. All right? They're lying about it. Alcohol abuse can create that stomach acid producing tumor. So any alcoholics, this is how you can catch it. You don't want to create that tumor. All right. Alcoholism is what causes this. So be very aware of that. Get your surgery done and get rid of it. That's way number 1. Okay, source number 2. And again, this is yet another misdiagnosis. Some of you have a parasite. It is a roundworm. Roundworms create many diseases. This one in particular is called Ascariasis. That is Ascariasis. Some of you have these roundworms all in your body. Although they tend to be asymptomatic, there are certain things that can make the roundworms move. They go, especially in your lungs, they go through all of your bodily organs. So certain things like traumas, getting hit in certain areas, many things can aggravate this roundworm. Now, this roundworm is usually found in like bodies of water. So the first thing I thought about is going swimming. If you think of like the swimming pool should be fine because it's got chlorine, it's treated, all of that good stuff. But when you think of like lakes, canals, river streams, I don't know if you swimming in a dam, but a lot of bodies of water like that, what happens is roundworms are usually found in animal poop, animal feces. Check out my autism video. That's the problem there. And so how are you possibly ingesting these parasites? Because that's usually how you get it, ingestion. A lot of y'all swimming in these lakes, these streams, and the animals are pooping in it. You don't see where the animal is pooping in the water, and literally either it lives in the water or it's pooping in the water and it's flowing downstream and you swimming in it. I've been swimming in the lake one time in my life. And I remember when I was swimming in it, I was a teenager and I was like, people are we accidentally swallowing this water. We swimming in it like it's got chlorine. This is okay. And it's just something that's normalized. Everybody going to a lake and they swim like it's normal. It's a bunch of parasites and just illnesses waiting to happen. So what's happening is a lot of people are ingesting parasites, their eggs, roundworms, their egg, they're ingesting it through simply going for a swim. All right. So you got to be careful out there swimming in that mess. It's filthy. It's just a bunch of poop, feces, parasite eggs. So a lot of you could have possibly gotten it that way. But the cure is a simple one. That's the good news. There is a medicine called mebendazole. Mebendazole. That'll wipe that. It'll wipe all of those worms and stuff. In fact, there are many antiparasitic medicines that'll wipe the roundworm. This is a for sure cure. All you got to do is take the mebendazole and it'll get rid of all of those worms that's been wreaking havoc in your organs. And these diseases are causing the same symptoms. That's why they're all called asthma, because they're all doing the same thing. All right. So get those worms out of your system. Again, that's called Ascariasis. And you can just take mebendazole and it'll kill it. Let me reiterate something because I can't stress this enough. Y'all ingesting animal feces and they're full of parasites. You need to check your life and see the things that you are doing that might be a way that you're ingesting, these parasite eggs, like going to swim in a lake. Now take a look at your life and see what else you may be doing that could accidentally have these animal feces going in your mouth. Ugh. I know you didn't know, so it's cool. Just get healthy. That's all I'm saying. Get healthy. Okay, number 3. And remember, be checking all of these off now. Go through all of these. Number 3, some of you simply have heavy metal poisoning. You need to get your body checked for heavy metal poisoning. All right. 2 of the most common heavy metal poisonings that can lead to asthma I know of is mercury and antimony. All right. I know antimony can give you headaches, dizziness, nausea, vomiting, abdominal pain, loss of sleep, a lot of the same asthma symptoms. Okay, you catch that a lot of times by inhaling a lot of dust. Too much dust, some of that dust, especially maybe if you work in somewhere industrial, too much of that can give you asthma. Whether they put you on chelators or what's the other one? Dialysis, whatever the treatment they is, make sure you get that metal out of the system. That alone may cure you up if that's the source. So, we don't have to spend too much time on that. Some clothing, I don't even know why these clothing can be sold, like polyester. You have to watch wearing that stuff because some of that can get in your system. Just wearing clothes, polyester for a long time can give you antimony poisoning. It's crazy how much stuff is out here ready to get us sick, yet, they can still sell it. So get that heavy metal poisoning checked and make sure you clean, all right? To add to that, a lot of clothes with a lot of dye. Watch out for a lot of clothes with dye because a lot of metals, get into the dye and that can really get you sick. So, you just want to be careful. A lot of dye can lead to heavy metal poisoning. So watch out with that. Number 4, mold. The more and more, everybody know mold is bad. I hate mold. Mold is getting a lot of people sick. You literally can have a fungal infection in your system, in your body due to mold. If you're in a house with a lot of mold, that's going to lead to asthma. All right. Mold is a bunch of fungus. I believe that can lead to a lot of bacteria. Okay. So to cover a lot of these, from pneumonia to strep throat, any other problems you may have, as well as the mold fungal infection. Look, you can get amoxicillin or neomycin to kill any bacteria, and then you can use fluconazole to kill the fungus. Any bacteria or antifungal medications, you can get rid of that with. All right, so I named a few, but my point is to be a catch-all. To prevent from overlooking any illnesses, you want to take amoxicillin with fluconazole. Oftentimes they're grouped together anyway, because I think amoxicillin can cause, say, like yeast infections in women, but fluconazole can help that. So any sickness you see or don't see, that should cover a lot of those illnesses. Definitely if you have an if you have a fungal infection. You can kill that. You can kill any streptococcus, any whatever is in there. That's like a catch-all, is what I'm trying to explain. It may be a hard task to stay away from mold that is literally everywhere, but at least we can kill it. We can kill any fungal infections, because that's one of the big ones when it comes to asthma. So you want to check that off your list. So now we're at number 5, and excuse me, I didn't want to make this video too long, but this particular disease, it calls for it. It is very complicated. There's a lot of steps to it. All right. So number 5 is you need to be checked for cerebral berry aneurysm. You need to check for an aneurysm in your head. Okay. That could be an aneurysm. It could be ruptured. It could be leaking, whatever the case may be. Well, a berry one would be definitely like swollen. If you look at it on the internet, it looks like a berry. That can cause all kind of problems in your body, and a lot overlap with asthma symptoms, and then some. Nausea, vomiting, stiff neck, drooping eyelids, blurred double vision, sensitivity to light, seizures, loss of conscious. Ooh. They got unruptured aneurysms, pain above or behind the eye, a lot of stuff, enlarged or dilated pupil, vision changes. A lot of this is the same thing. A lot of you can cure your asthma with a head, if you get your head checked for an aneurysm. Now that's going to require surgery in the head. I mean, you're going to want to hope that's not the one, but if you can get that taken care of, that is a cure. That is a cure. People should get checked for aneurysms a lot more. Blood clots, aneurysms, tumors, those should be routine checks, because a lot of people are sick because of these things. If you're an asthma patient, you may have an aneurysm in your head. Make sure you get that checked out and taken care of. All right. So of those 5 I mentioned, you most likely got one of them. All right. Don't overlook those aneurysms. They'll make your life a living. You know where I'm going with that. Get all of those 5 checked. Now, for some side notes, what I want people to look at too, some of it goes without saying. Definitely search and patch up the ulcers. Any ulcers, I think they're going to use the cauterization, which I think that's like burning it to make it stop, especially if it start bleeding, they burn it. So of course you want to take care of stuff like that. I know for the Zollinger-Ellison syndrome, they're probably going to do an upper endoscopy. They're going to do the upper endoscopy to check for that. You want to get on your prednisone, your anti-inflammatory, immune suppressants for those who need it. You know, all of the well, I don't want to call them little stuff, but yes, you want to definitely check all of that stuff. Your corticosteroids. You want to remove any fluid from the lungs. That's another one. And again, I'm for some kind of antibiotic to clear up any infection in the lungs, like a amoxicillin or something. And again, you might as well just pair that with the fungal infection to take that on out. Fluconazole. Oh, these names. I'm learning. Yeah, so definitely the little stuff. And then even if you're cured, which we know you're going to get cured because I'm good at what I do, you may want to keep your inhaler until you feel comfortable without it. I don't want to tell anybody to go cold turkey. If you feel safe with your inhaler around just in case, by all means, do what you got to do. All right. And basically what I'm trying to say is, hey, don't, the little stuff, you make sure you take care of that too. I'll definitely be on the prednisone. If you've had any trauma to your head, anywhere that you can remember, make sure to get checked for that aneurysm, especially the berry aneurysm. This was a lot of information. It's very complex. If I have to update, I will. But for now, that's all I got. Go get your asthma cured. I'm confident in this. And come back and see me, Charmaine Santier, Lear Liar Lottoriddles Institute of Health Research. Go get healthy. Go get healthy.